Concerns are being raised over the high number of teenage pregnancies. Of the close to 2,000 babies born on New Year's Day, over 100 of them were teen mums. The youngest is believed to be just 13 years old. Deputy Health Minister Dr. Sibongiseni Dhlomo joins me now. Dr. Dhlomo, thank you for joining me. More than 100 underage mums giving birth on New Year's Day alone. How worried is the Department of Health?
You see, that number is very worrying. It means on average, we are talking about 50, on average, more than 50 teenage pregnancies per day. Now you count 365 days in a year. That is how bad the situation is. It is really worrying. It's multifactorial. Part of which we have taken up is a responsibility as a department to say, some of the teenagers are saying, but I didn't want this pregnancy. You were not available to assist me and advise me to prevent this pregnancy. As a result, I fell pregnant. Of course, I didn't know also about the termination of pregnancy procedures. So here I am. So part of that, we are therefore working on that process and creating what we call youth zones, where we are saying, let's create a platform where we are friendly to the young people. Let's talk to a 16-year-old to come to our facility and say, here I am, sexually active. I want to finish my matric in 3 years' time. I don't want to fall pregnant. What can you do to assist me? We need to deal with that part before we can be able to criticize and work on that. But again, there are multifactorial issues, poverty, other problems that are there in the society, sugar daddies, and all those that we have to work on. But we also are starting with what touches us as healthcare department and healthcare workers, being friendly and not being judgmental to young people who come to our clinics and hospitals asking for the service, not to fall pregnant while they are already sexually active.
It's very interesting that you say the teenagers, when they fall pregnant, say that actually you didn't, or perhaps they didn't have enough education about it. Is there enough education around contraception maybe? Are there perhaps social taboos that are preventing people from using contraception?
You know, it's a very big problem. Me and you sitting here on this interview, we want to believe that our teenagers are innocent, they don't get into sexual activity and all that. And therefore, when we try and say, let us introduce some health education on family planning in high schools, many SGPs will say, no, but that is too early. Our teenage girls and boys are not involved in that. And none of them actually have the story because their children don't tell them those issues. So we are actually navigating through that part where parents, school governing bodies are saying it's too early to talk about this in our high schools, and yet we do really experience teenage pregnancies in high schools and out of school. So we are really discussing that matter to say, please do allow us to introduce some health education, some family planning, sexual and reproductive health services and discussions in high schools and everywhere else, because they do fall pregnant.
Absolutely. We know that in society it does appear, though, like you said, families don't want to discuss this issue about sex. So it's a taboo subject. And this really limits discussions with teachers and other family members. Do you think peer pressure is maybe playing a role in youngsters engaging in unprotected sex and then not fully understanding the consequences that come with it?
The teachers, that they play a role. Look, we don't want to apportion the blame to any one sector, but it starts with me and you in our own families. What value systems do we give to our children? What support do we give to teachers, educators, and everybody else there talking about it and allowing space? For some of them are not trained as educators to talk about these issues. But you know now that because of this process, we have started what we call school health nurses, things that were there during when our mothers were in schools. School health nurse, a nurse will come to a school to advise about cleanliness, about hygiene, and therefore begin to introduce a bit of these subjects about teenage pregnancy, family planning, avoiding this and that, avoiding sexually transmitted infections, avoiding HIV infections. And those things are very critical to be introduced at a particular age of our children.
I know you mentioned that there are plans going forward to have greater discussions about sex education in high schools. But sex education has been around for quite a lengthy period of time already. Where are we going wrong with this process? Because going forward, how soon do we see this being implemented, and what is going to change?
Look, my dear, I would like to say to you what we see is also a result of the health education being introduced in those areas. I can tell you, if we left things and we didn't do a bit of it, we'd be having much more than what we see. We are really all out there in the communities, in schools, in universities, talking about it, bringing those awarenesses. We all are saying that we need parental support because even in university, we do have what we call higher health. The Department of Higher Education has actually said, we want to go to our university students. Department of Health, come along with us, because this is not our area of skills. You talk about these issues amongst our university students so that they know better and be equipped and actually be skilled on these issues. So I would actually want to say to you, what we see is actually already an impact of some of those educational processes. If we did not have that, we would even have more of that than if we had actually done it.
You mentioned parental support. What does parental support look like to you? Because discussing sex with a child or with your child has got to be an extremely difficult thing.
I missed that. You talk about what? Family support.
Parental support. You mentioned parental support.
Yeah. The first thing is for me and you not to shy away from thinking that our teenage girls and boys are not exposed to sexuality. That's one thing that parents should actually begin to understand. Because children will not come and discuss that, Mom, tomorrow I'm going to have a sexual activity engagement. What's your view on it? So they start it without us. So all we need to say, let us give space and allow some of those who are skilled to navigate through. That is why we are saying we commend those young teenagers who come to our clinics and say, I am already sexually active. Please assist me. And we therefore say, in a broader sense, because they are educating us in the clinics, we don't want to be seen by a nurse, a doctor of your age, Dr. Dhlomo. You are too old you look at me as a father figure, a mother figure. I want a younger nurse I could negotiate and discuss these issues with. We want to have platforms where we can open up again and have many more of these youngsters. So when we talk about youth zones, these are certain secluded areas in our clinics where we bring a nurse who has been trained not to be judgmental, to be supportive, but to be supportive, to say, speak to these high school children who have this desire to understand and all this. So we want to expand on that. We want parents to begin to understand that they are not going to be asked permission to involve themselves in sexuality, but they do. So let us therefore err on the side of giving them information, giving them preventative measures. Let them pick and choose on what they need. But we cannot say, let's do it on grade 7 because they are already sexually active. Let's not do it on grade 6. And so all those processes are things that we need to navigate, but more so in respect of the views of the school governing bodies, because they are very clear about what we give and what we don't give to their teenage children.
Doctor, I have to ask, these concerns that have been raised by the youth, surely it's not the first time the department is hearing them, because I imagine that these concerns have been raised over a period of time with teenage pregnancies just increasing the way we've seen it over the past few years. How come the department's only acting now with these youth zones?
No, it's not only now. We listen to children, we hold dialogues with young people. The youth zones were out of the desire of young people to say, Dr. Dhlomo, but when I go to the clinic, I find a nurse of the age of my mother, and I'm not able to discuss that. We didn't know that that is having an impact, a negative impact on them accessing the service. They educated us, and therefore that's why we acted on it. But over the past 2 years, you probably noticed that we had a lot of teenage pregnancies probably related to COVID, because students who were supposed to be at school, however, getting into that, were all left by themselves at home. Parents were struggling to be here and at home and work, and therefore there was just a lot of free time for our students, and therefore not able to engage them on these educational processes, but having a lot of free time for them to really do whatever they would want to desire. But I'm actually saying even these youth zones have been created out of dialogues that we have listened to on young people saying, but can you provide us this and that? That is why, among other things, young people said to them, can you provide us with flavored condoms? Now we know there's a banana flavor, a grape flavor, and all that. So all of those things, we engage with them, say, guys, we want to decrease the teenage pregnancy, sexually transmitted infections, HIV infections. What can we do as government, as a department, to support your plight, your desires, and your processes? Through that, we learn, and therefore we implement some of those issues.
Well, I'm very glad to hear that the department is listening to what the youth have to say. Hopefully it does have a positive effect in the long term. Just moving away from teenage pregnancies right now, can you give us any update regarding the victims of the Boksburg fire? How many people are still in hospital and currently recovering?
Firstly, we just give our condolences to those who have passed on, to the families, and we have already been dispatched by the Minister of Health countrywide to support the funerals that are taking place in Limpopo, KwaZulu-Natal, Gauteng. Minister has been to some of the funerals. I will also be attending some of the funerals in KwaZulu-Natal. There were 37 that were initially remaining hospitals, but the number has increased to 50. And we'll continue to check as to how many are recovering, but each day comes in with a different number in terms of people recovering and getting discharged. But for now, they are standing at 50 that are still hospitalized.
Thank you for that update. A final question. We're also seeing quite a significant increase in COVID numbers in China on a daily basis. As South Africans, should we be concerned?
Let us wait a bit. The minister is as concerned as all of us. There is a meeting that the minister is planning to have tomorrow, where we will converge all of us, scientists and all other people, to advise him what to do. So let me not really preempt and say something before we could hear from the scientists, but the minister has actually taken it upon himself to call up a meeting where scientists and all other people who are advising us will then converge and give us what to do with regards to what we see in China and what we also see coming up in the world.